Dr. Zhang is the director of the National Institute of Nursing Research. She joined NINR in September 2020, following a 14-year career as a faculty member at the University of Illinois, Chicago College of Nursing, an Institute for Health Research and Policy. Her background is in nursing and public health. Dr. Zhang's research focuses on community environments as a social determinant of health and health inequities. She and her team conducted pioneering research on food deserts in the United States. They have since generated evidence on how food accessibility and other aspects of the built environment affect individual diet and physical activity behaviors, body mass index, and weight management intervention outcomes. They have also evaluated policies and investments that affect community environments for their impact on health and health inequities. This work has leveraged a variety of new technologies, such as GIS and mobile GPS sensors, and emerging data resources, such as electronic health records. Dr. Zhang's Neighborhoods and Health Lab is now housed at the National Institute on Minority Health and Health Disparities. There will be approximately 10 to 15 minutes for questions at the end of the presentation. You can submit your questions in the chat during the presentation. Welcome, Dr. Zhang, and thank you for joining us today.
Thank you so much, Dr. Chang. Good morning to everyone. Thank you for that kind introduction. It's a pleasure to be with you. Let me share my screen. All right, so again, thank you so much for the invitation. It's a pleasure to be with you, joining you on your annual research day. And I certainly hope that my remarks today on the state of nursing science at NINR is a helpful guidepost in your own research interests. So before I get started, I'll give you a brief preview of my talk, which will include a little bit about my start in nursing research, which shaped my interest in health equity, where I see NINR supported nursing science going over the next several years under the upcoming strategic plan, research and partnerships at NINR and NIH, and our commitment to diversity and inclusion. So I'm looking forward to the question and answer session at the end as well. So as was mentioned, I joined NIH and NINR during the first year of the pandemic. And if anything, my NINR tenure has thus far underscored for me how essential nurses and nursing science are in the ongoing COVID response effort. And it's also highlighted how nursing science can improve, and indeed how it must improve, the health for all Americans. For NINR as an institution, and for me as a researcher, this means striving for greater health equity. Now, health equity means different things to different people, so I'd like to take a moment to define it. And one definition that I like is the Robert Wood Johnson Foundation's all-encompassing definition. So here it is. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Now, my enduring interest in health equity began at the very start of my nursing career, with the kinds of experiences that inspired me to consider the obstacles that so many people face in optimizing their health. Perhaps like some of you, one of my first jobs in nursing was as a home healthcare case manager. In this role, as you know, I visited patients in their homes, typically after a hospitalization, to provide wound care, help with pain management, and teach about chronic conditions. And it was in spending time in people's homes and in different communities that I was struck by the tremendous differences in the environments of patients in my caseload, both in terms of privilege and poverty. And I found it difficult to talk to some patients about, say, healthy eating when what they really needed were the fundamentals, such as decent and stable housing, a safe environment, and access to affordable, healthy foods nearby. This led to an intense interest in how resources and risks are unevenly distributed across communities and the resulting implications for people's health and health inequities. So my own research has primarily focused on food environment inequities. My team and I conducted some of the early work in the United States on what we now call food deserts, or communities with insufficient access to healthy foods. Research has documented, though, that it's not only healthy food resources, but a wide variety of other resources that are unequally distributed across communities. These include jobs that pay a living wage, good schools, municipal services such as public transit, pharmacies, attractive parks and green spaces, destinations and infrastructure for walking and biking, as well as clean air and water. Research also shows, though, that low-income communities of color are often subjected to more risks, such as greater availability and marketing of tobacco, alcohol, and junk food, excessive monitoring by police and immigration officials, pollution, and toxic substances. So my team and I have since generated evidence on how food access and other aspects of the built environment are related to individual diet and physical activity behaviors, as well as body mass index. However, we've learned things along the way. So for example, we found that setting up a supermarket is not a panacea. For example, it might not immediately change individual fruit and vegetable intake or body mass index. Instead, we need to take a life course perspective and ensure that people also have the individual resources needed to take advantage of new community resources. This includes sufficient income to afford healthy foods, time to prepare healthy foods, and relief from adverse living conditions and experiences so that healthy foods aren't needed to alleviate the psychological and physiologic stress responses. We were early adopters of the increased scientific focus on the broad array of social determinants of health and the necessity of understanding individual and community needs through their real lived experiences. So because of research like this, the public and policymakers now understand that there are communities through no fault of their own lack the resources needed to live their healthiest lives. And we know that historic and ongoing racial inequities are obstacles to health. The question then is, how can we bring the change that these communities need? And how can nursing science be a catalyst for this much needed change? It's a question that is at the heart of the evolving research priorities at NINR. The answer requires an all hands on deck approach, given the breadth of the problem. As I've seen in my own research experiences, it will take great determination if we're to do more than just put a Band-Aid on health inequities. It is these avenues of research, these probing questions about how nursing science can help whole populations of people that ultimately led me to NINR. So as was mentioned, since coming to NINR, I've been working to set up my lab at the National Institute on Minority Health and Health Disparities. This is typical, it's customary for NIH directors to house their labs outside of their own institute. Our focus will remain on understanding how community environments affect health behaviors and outcomes in African Americans. But we're also in the process of developing a new line of research related to climate change, investigating multi-level determinants of and disparities in personal heat exposure and the implications for individual health. So I'm fortunate to be working with three very talented fellows, Dr. Kelly Jones, Dr. Lauren Reed, and Dr. Xiao Shi, and we are currently recruiting for a staff scientist. So if you know anyone, send them our way. So now I'll discuss how I'm bringing my nursing science background and my health equity perspectives and those of many other investigators to NINR. I first learned about the NINR director position while I was engaged in research and mentoring at UIC, but I was intrigued by the idea of leading at a much larger scale. And I recognize this as a once in a lifetime opportunity to apply my experiences both as a nurse and as a researcher and to have a greater impact on practice and policy. So my view at the time, to quote Lin-Manuel Miranda's Hamilton, was that I'm not throwing away my shot. My shot was to advance the science on health equity from a nursing science perspective from a more strategic position. And now as director of NINR, I am honored to be part of an organization with the goal of improving millions of lives. As you can see here, we're committed to solving pressing health challenges and informing practice and policy to optimize health and advance health equity. A big part of achieving this mission will involve addressing the impact of social determinants of health. And I believe that now is the time to act. Structural and social factors have long influenced health, but the COVID pandemic made their impact exceedingly clear. Throughout the pandemic, we saw that people of color were more vulnerable to COVID's impacts on health, well-being, and finances. And very alarmingly, we saw that disparities in life expectancy grew larger for people of color. We know that even before COVID, structural and social factors have been drivers of persistent disparities in rates of chronic disease, maternal and infant mortality, vaccination adherence, injury and exposure to violence, and so much more. These disparities will certainly outlast COVID, but it's our responsibility and our duty as nurses to do everything we can to solve the upstream problems that perpetuate inequities. Now, nursing's earliest pioneers recognized that health must be considered within the context of people's lives and their living conditions. In other words, they were among the earliest to incorporate social determinants into their solutions for health problems. Florence Nightingale was one of the first to recognize and address the connection between health and environmental elements, such as ventilation and warming, clean air and water, noise pollution, and provision of light. Lillian Wald saw nurses as working at the intersection of medicine and society to care for individuals, families, and communities in the context of social, economic, and industrial conditions. And we continue to build on this rich history through nurse-led efforts to address intensifying inequities and social determinants of health. In fact, the recent Future of Nursing report from the National Academy of Medicine and the Robert Wood Johnson Foundation makes a compelling case for new nurse-led models to address social determinants of health and social needs. So consistent with the National Academy's report, we are building on the strengths of nursing science and on NINR's scientific foundation to address social determinants of health and social needs. For instance, already at NINR, most of our research directly involves. This is different than it at NIH as a whole. In fact, over 75% of NINR's funding supports research that directly engages human participants. We're at the cutting edge of research to mitigate disparities in health. At present, over 30% of NINR's funding focuses on research to eliminate health disparities. Very importantly, we're committed to funding underrepresented minority scientists. According to data from a recent NIH study, over 75% of the applications to NINR focus on topics on which African American investigators disproportionately apply, the second highest percentage at NIH. About a third of NINR's budget supports behavioral and social sciences research. This is the highest share among all NIH institutes and centers. And about a quarter of our budget is already dedicated to social determinants of health research. More than a third of the budget supports research on preventing chronic conditions, helping people stay healthy and reducing the risk of future illness. And over a half of those prevention projects include a randomized intervention, which is a much higher proportion than at NIH as a whole, which is at 17%. And we're focused on preparing the next generation of nursing scientists. As a percentage of budget, NINR commits more support to training new and early career scientists than nearly any other NIH institute or center. So now I'll explain how this foundation will support our new strategic plan. So first, as we conceptualized the framework for the plan, we actively engaged many stakeholders. We convened a working group with 20 external experts that provided recommendations through the National Advisory Council for Nursing Research. We reviewed 385 online responses to our Tell Us What Nursing Research Means to You campaign. We reviewed more than 100 emails in response to an open call for input on the development of the strategic plan. I personally participated in my first 12 months in 80 meetings and presentations with external groups such as this. And we reviewed over 130 public comments from our request for information on the draft strategic plan research framework. So in developing the framework, we embraced the many respondents who have asked that we support research on health disparities. As a result, our framework explicitly supports research topics that explore the intersection of healthcare and public health through the lenses of social determinants of health, health equity, and community health. So I'm excited to share a little bit more about the framework on which we'll build our new strategic plan. So this framework includes a set of guiding principles that we believe should drive all areas of NINR supported research, as well as 5 research lenses that describe broad perspectives by which to examine health challenges. So first, I'll describe our guiding principles and what they mean for researchers funded by NINR. Our guiding principles describe important qualities that all NINR supported work should have going forward. In considering awards for funding, the extent to which studies reflect these principles will be a factor in our decisions. We need to support research that's innovative, applies rigorous research methods, has the potential for significant impact on health and well-being well beyond the initial study sample, advances equity, diversity, inclusion, and accessibility, addresses today's challenges and helps us be better prepared for the future, and provides solutions to optimize health across clinical, community, and policy settings. So now let me explain what we mean by a research lens. As we know, the field of nursing science is comprised of many different perspectives on what topics nursing science should address and how we should do so. Simply put, when we say a lens, we are describing a perspective through which to examine an identified health challenge. In developing the framework, NINR identified 5 lenses that we think best leverage the strengths of nursing science to innovate, think bigger, and greatly increase our impact. So let me give you a closer look at each of these research lenses. Health equity includes studies aimed at producing evidence needed to reduce and ultimately eliminate the systemic and structural inequities that place some population groups at a disadvantage in attaining their full health potential. Social determinants of health include the conditions in which people are born, live, learn, work, play, and age. We believe because these determinants impact so many facets of our health and well-being, we think it's vital that research to support research that will examine them and identify effective approaches to address social factors and social needs to improve health. Population and community health includes studies that address critical health challenges at a macro level by focusing on interventions that affect groups of people with shared characteristics or who live within a shared area. Prevention and health promotion include projects studying how to prevent disease and promote health through the continuum of prevention, with a particular emphasis on eliminating health disparities. And finally, systems and models of care include research that addresses clinical, organizational, and policy challenges through the development, dissemination, and implementation of new systems and models of care, including those that bridge clinical and community settings with social factors and social needs. So here's what you can expect over the upcoming weeks, as well as the upcoming months. The strategic plan will soon be published on our website. You may see some differences between the final plan that's published and the framework I described here today, but I hope that this gives you an idea of where we're headed. After the plan is finalized, we'll begin the hard work of implementing it in the research we fund and conduct, and in the way we manage our institute. We're also considering a wide variety of events that will highlight important research in these new areas of emphasis. Though these events will be targeted towards potential applicants, many of you, regardless, may find them informative. So the bottom line is to keep monitoring our website, our Twitter feed, and our news feed for the very latest. So though our new strategic plan is not yet published, NINR is already supporting health equity research. So let me share some of the funding opportunities that we're leading or supporting to advance science, which we believe are essential to ensure that everyone has a chance to attain their full health potential. As you might expect, some of the funding opportunities address the ongoing COVID pandemic. For example, NINR is one of 11 institutes, centers, and offices to sign on to a notice of special interest, highlighting the need for research to address vaccine hesitancy among populations that experience health disparities. Though not limited to the SARS-CoV-2 virus, we know that vaccine hesitancy is an ongoing issue in fighting the pandemic. With this notice, we hope to examine community-engaged interventions, evaluate policies and initiatives that mitigate or exacerbate disparities in vaccine access, uptake, and series completion, and understand and address barriers to increasing reach, access, and uptake of vaccinations. So this funding opportunity opened in December and is accepting applications until January. Additionally, NINR and other NIH institutes, centers, and offices are participating in an initiative on social, behavioral, and economic impacts of COVID-19 in vulnerable and health disparity populations. One study that NINR has already supported through this mechanism is examining whether an intervention in South Carolina for both African American COVID-19 survivors with underlying chronic conditions and their informal caregivers is effective in improving health and quality of life for both partners of the dyad. The intervention will focus on overcoming racial and pandemic-related stressors in the context of community social vulnerability. So as always, you can find more information on these opportunities at the grants website. And of course, we continue to support health equity research outside of COVID as well. For example, we've signed on to a funding announcement to support innovative, collaborative, and multidisciplinary research to study the effective adaptation, integration, and implementation of recommended guidelines of care of persons with multiple chronic conditions from populations that experience health disparities. So I certainly hope that many of you will consider how your work might fit. We've also signed on to an important funding announcement to develop and test interventions at the community or community organization level that seek to prevent firearm and related violence, injury, and mortality. Though violence affects people of all ages and its impacts are far-reaching, it constitutes a major public health crisis, especially among young people, and in particular among racial ethnic minority, sexual and gender minority, and disability populations. For instance, firearm homicide is the third leading cause of death among persons aged 10 to 24 years, and the leading cause of death among Black men. So for those who are interested in this RFA, NIH's Office of Behavioral and Social Sciences Research recently held a technical assistance webinar, and that recording is available. I am also proud that NINR has led on several initiatives related to health equity and minority health. These include funding opportunities on maternal health outcomes among women who experience persistent disparities, and the impact of pandemic-related food and housing programs and policies on health outcomes in disparity populations. And we've supported additional health equity research on topics such as the effectiveness of school-based health centers to address the needs of underserved youth, improving Native American health, and advancing health equity and pain. So again, all this information on these opportunities are on the website. And of course, always feel free to reach out to NINR staff with any questions. But I also want to remind you that investigator-initiated applications in health equity, so these are applications not in response to any particular funding opportunity announcement, are always welcome, as are applications aligned with our other strategic priorities. So in support of our guiding principles for research, particularly towards advancing equity, diversity, and inclusion, we're making sure that NINR is at the table and leading efforts both within NIH and across the federal government. So I want to highlight two of those. For instance, I'm excited to share that NINR is helping to lead 2 Common Fund programs to advance health equity. So as background, Common Fund programs at NIH address emerging scientific opportunities and pressing challenges in biomedical research that no single NIH institute or center can address on its own, but are of high priority for NIH as a whole. So the Common Fund is a unique resource at NIH where high-risk, innovative endeavors with the potential for extraordinary impact are supported. So launched in 2021, the first was the Transformative Research to Address Health Disparities and Advance Health Equity program. So this program is supporting innovative translational research projects to prevent, reduce, or eliminate health disparities and advance health equity. I do want to point out that the RFA for minority serving institutions was recently reissued for this program with a May 23rd due date. But recognizing the urgency of research on health equity, NINR, along with our colleagues from several other NIH institutes and offices, is also co-chairing a second new 10-year, $397 million NIH Common Fund program called COMPASS. COMPASS will be transformative and help us to make real progress in eliminating health inequities and achieving health equity by looking upstream at the systems and structures that are causing socially and economically disadvantaged populations to become sick in the first place. The program has 2 overarching goals. First, the program will facilitate and implement a cross-NIH framework for health equity intervention research. Second, it will deploy and evaluate community-driven structural health equity interventions that leverage intersectoral partnerships. So I am excited that nursing science and NINR are at the table and involved in this important program. NINR, though, is also helping to develop and lead other initiatives, including a new Trans NIH Climate Change and Health Initiative. This initiative will support research to understand the potential health benefits of actions to prevent, mitigate, and adapt to climate change, especially for at-risk populations and communities. At NINR, though, we acknowledge our efforts towards achieving health equity depend, at least in part, on our efforts towards diversity. Quite simply, greater diversity and inclusion in our science greatly enhances the quality and impact of it. And I know that the University of Buffalo shares our dedication to health equity through its Community Health Equity Research Institute, where Dr. Grinslade, clinical professor at the School of Nursing, is an associate director. We also know the School of Nursing's justice, equity, diversity, and inclusion efforts will also be so critically important in this area. And I couldn't agree more with this statement from the School of Nursing, which is, as nurses who pledge to provide care for all human beings, we must take a stand against the structural and systemic racism that is ingrained in every aspect of our society. So I certainly thank you for your ongoing commitment. At NINR, we're addressing the issue of diversity in the nursing science workforce by participating in two important NIH initiatives. The first is the FIRST program. NIH aims in this program to facilitate institutions in building a self-reinforcing community of scientists through the recruitment of a critical mass of early career faculty with a demonstrated commitment to inclusive excellence. The second is the Mosaic program, which aims to support a cohort of early career independent investigators from diverse backgrounds, with a goal of enhancing diversity in the biomedical research workforce. And we also support predoctoral fellowships to promote diversity. We encourage all investigators with an eligible grant, such as an R01, to submit a diversity supplement and help ensure our work is inclusive of everyone. Diversity supplements have been shown to help launch successful and productive careers for scientists of diverse backgrounds. NINR supports diversity supplements to enhance the diversity of the research and the entrepreneurial workforces. This includes eligible people from groups that have been shown to be underrepresented in health-related research or in the small business programs at NIH. Part of increasing diversity among NINR-supported scientists includes ensuring opportunities are available to scientists and students at a range of institutions. As a result, we're participating in the NIH Research Enhancement Award Program, or REAP, which is designed to stimulate basic and clinical research at educational institutions that provide baccalaureate or advanced degrees for a significant number of the nation's research scientists, but that have not been major recipients of NIH support. So it's hoped that this program will expose students in such environments to meritorious research. Eligible institutions must award NIH relevant baccalaureate or advanced degrees in health professions and have received less than $6 million per year of NIH support in the majority of the last 7 fiscal years. So I certainly encourage all eligible institutions to apply and urge all of you here today to share this announcement among your networks. We are also, though, eager to learn what more we can do to significantly strengthen diversity and inclusion. So towards that end, the NINR Advisory Council impaneled 2 working groups that are addressing diversity and inclusion in our research workforce and in the work we support. These groups are meeting and ongoing, and we're really looking forward to hearing from them as their work progresses and to hear their recommendations. Before I close, I'd like to share just a few additional thoughts on the importance of nursing science to health and well-being. As you all know, nurses are everywhere, in our hospitals and clinics, in our schools and workplaces, in homes and justice settings, and throughout our communities. We approach prevention, treatment, and care holistically and in context. And the scope of our practice and discipline extends from improving the health of individuals to that of entire populations. So what sets NINR apart from other NIH institutes is that our research is focused on health solutions for people in the context of their lives and their living conditions. It's our unique perspective that makes our scientific discipline so well positioned to lead research focused on the whole picture of health, from the biology of a person's cells and genes to their whole self, their family and resources, and the community and society in which they live. The New York Times recently trumpeted the following headline from its pages in a story about nurses. It said, "Nurses have finally learned what they are worth." Well, we have always known our value, and it can't be measured in dollars and cents alone. We bring something intangible, but yet essential. We bring hope. At NINR, we are striving to nurture hope, the hope of a better, healthier tomorrow for millions. So thanks again for inviting me to talk with you today. I look forward to hearing more about your interest in the question and answer session. And I do want to share our email address. So if there's anything that we don't get to discuss today or any program on which you want more information, please feel free to reach out to us and we'll be happy to get you the information you need. So thank you again.
Thank you so much, Dr. Zenk, for that wonderful presentation. And thank you for recognizing our work regarding the community collaboration and addressing health inequities through some of our UB institutions. So there are a few questions already in the chat, but I would like to begin with the question regarding the community engagement and community-based participatory research. So Dr. Zhang, based on the funding opportunities that you just present us, what you see community engagement strategy and community-based participatory research fit into those opportunities?
Thank you for that question. Well, I think it is quite clear, and I think especially to nurses, just how vital it is as we think about research and think about solutions to engage the people who are affected. They know what is most likely to be effective and what is most likely to be needed. And so I think community engaged approaches are so important. I think as an example, the common fund programs that we've been helping to lead, community engagement is at the core of those efforts. So I certainly encourage us to continue things that are of value, have always been of value in nursing, to engage with communities, to partner up, to identify important research questions, and to conduct our research.
Thank you. And the next question from Caliara. Does NINR have specific grants directly to support early career nurse scientists of color?
Mm-hmm. We do. I did try to highlight a couple of them in the presentation, but I would strongly encourage you to reach out to program staff at NINR. You can we are in the process of updating our website, but you can always use that general email address I shared, and we'll be sure to get you connected to the right person. So there are a variety of mechanisms available, and so please do reach out to program staff to help you identify what options may be best for you.
Thank you. The next question is regarding symptom management among individuals with chronic condition focus used to be one of the NINR strategic plan. Can you elaborate on how I may apply my research focus to be suitable to the NINR new mission and not new mission, NINR mission and a new strategic plan?
Yeah, absolutely. So certainly, we are very proud of the accomplishments of NINR and nursing scientists in the area of symptom management. We're proud of the impact on practice and the community of scientists that have been built. So as we move forward, we are not explicitly prioritizing, for example, symptom science at this point. What we're doing instead, very purposefully, is framing the new strategic plan in terms of perspectives. So those 5 perspectives by which we can examine a whole wide variety of topics. So we think this is very important to maximize the opportunities that nurse scientists and nursing science have to make a difference in a wide variety of topics, symptoms certainly, but a wide variety of other topics as well.
Thank you. The next question, we are reviewing our PhD curriculum, and how do you think that we can include training in environmental and climate issues that nurses could use in advancing science?
Yes, I think it's so clear that climate change is one of the most pressing health challenges that our country faces. Not just health, but a wide variety of other issues as well. And the American Academy of Nursing has recognized this in the past. It's been a priority, climate change of that group in the past. So I think there's many in nursing who care about this issue deeply. And I think we do need to think about how we can prepare nurse scientists to address any challenge that comes up, including climate change. And, there certainly are opportunities for nurse scientists to specialize in climate change. I think the best way that we could think about that is thinking about who we can partner with other disciplines. We know no discipline, including our own, has all of the answers. So I think the extent to which we can partner, for example, in this area with environmental health scientists and others, to become skilled in this area of science, I think will be an advantage to us as we move forward.
Thank you. The next question, understanding that the external structures are highly important and involved in health disparities, is NINR also focusing on personal and community healthy behavior change for prevention and reversal of chronic disease?
Could you I want to make sure I caught the whole question. Can you repeat it?
Sure. I think, is NINR also focusing on personal and community health behavior change for prevention and reversal of chronic diseases?
Yes, I think so. One of the lenses explicitly is around prevention and health promotion. And I think all of the lenses or perspectives that are in the draft strategic plan framework can be applied to individual health, community health, and population health. So I think it's a very flexible framework, allowing for us to study a wide variety of topics and at the individual level, community level, and population level.
Thank you. And then the next question is related to access to data. So access to data elements that support health disparity research is a current challenge. Is NINR supporting any initiatives to specifically improve this?
To improve access to data, is that
That's correct. Yeah, improve the access to data to address health disparity research.
Yes. Yeah, I can't share anything right now, but I mean, this is certainly a topic of conversation at NIH. Data science, data availability is certainly that, there's going to be new policies around data sharing for our, how to make that's been, evolving over time at NIH for a while now, but it'll intensify in terms of policies that make data more available to everyone. So even if the data weren't collected as part of your project, there'll be policies and more infrastructure in the coming years to share data that has been publicly supported so that anyone can make use of those data to answer important research questions. And I can't share more specifics, but we're talking about it in lots of different areas, in areas of research, how to make data available that can facilitate research, including in the area of health disparities. So it's of interest to us, and I think you'll see an increased emphasis on this area as we move forward.
Okay, thank you. So there's another question related to the use of data. So one of the participants was wondering about if secondary data analysis a funding priority to the NINR.
Yeah, we don't have any restrictions in terms of research design at all. I mean, I think the research design should match the research question. So what data, secondary analysis, primary data collection is needed to address the research question and ultimately solve pressing health challenges. So we, in the draft strategic plan framework, simply ask that people submitting applications to NINR consider our guiding principles and apply one or more of the research lenses. So at a very basic level, that's what's requested, and the rest is really up to the investigators to make a compelling case for what is most appropriate.
Mm-hmm. Thank you. And then another question is related to education research. So how does NINR see nursing education research fitting into this new strategic plan?
I can't comment on what will be in the final version of the strategic plan. I can only comment on what's in the draft framework that we published in the fall and that I presented today. But I can say in general that our focus really is on supporting research focused on improving the nation's health and addressing health equity. Mm-hmm. So that will remain kind of our guiding, North Star, so to speak.
Mm-hmm. So next question is, are there any NINR efforts to expand knowledge on how to better support nurses and retention measures?
Oh, I'm sorry, can you repeat that?
Yeah, are there any NINR efforts to expand knowledge on how to better support nurses retention measures? Maybe Victoria, would you like to articulate your question? I'm not so sure either regarding your question. Victoria, are you in?
Victoria, if you just want to unmute yourself, you can ask your question.
Hi there. Yes. Well, I'm sure many are aware that we're facing, or hospitals are facing nursing shortages. There are a lot of issues surrounding nurse retention. There are many numbers reported of nurses potentially leaving the profession, which is quite concerning. So I'm just wondering if the NINR has any measures to look and understand the current situation and how we can support nurses and hopefully keep nurses in the profession.
Our focus is on improving the public's health and and the health of everyone, as I mentioned, in terms of health equity. But we've always known in nursing, but I think the pandemic has made many others aware of how important nurses are in achieving that goal, and nurses as agents for change and solution for improving the nation's health. So, and nursing can't do that, right? We can't achieve our potential if we're not protecting and looking out for the health of nurses. So that's certainly on our mind. We recognize it. At the January council meeting, we presented a concept on nurse burnout to council. Now, for those who aren't familiar, concepts are ideas or proposals that may or may not turn into funding opportunity announcements, but we did propose a concept at the January council, which council did approve, focusing on potential research on nurse burnout. I hope that answers your question.
Yes, thank you.
Just a follow-up question regarding that Victoria's question. Would NINR support like workforce development research?
Yeah, that isn't really under the mandate for NINR. That really falls for the most part with other federal agencies. So our focus really is on improving the nation's health. But, you know, I think there are some things that we recognize you know, are possible areas that we can fit in. And certainly we look forward to collaborating with other federal partners to advance that area of research.
Thank you. The next question, I'm trying to better understand. So Amanda, if you can unmute yourself, maybe it would be better for you to ask this question directly to Dr. Zenk.
Hi. Yeah, I guess I could just read it. I'm interested in understanding, and I guess this talks about what you were just speaking about, where the focus is really directly on patients, but I think nurses do have an indirect impact on patient outcomes. I think as I study care coordination specifically in applications and community-based settings for the purpose of doing research on, you know, outcomes in the setting of health equity, I'm interested in understanding how NINR's research can influence new role development for nurses, specifically new graduates who I think are coming out of school with preparation geared towards inpatient and acute care based roles. How can we start proving that nurses are valuable in the community more robustly, I guess, and what does NINR have to do with research that drives that?
Well, I think part of it, I think people are surprised to think about the many different settings and different roles that nursing plays. So our colleagues, for example, at NIH and many other stakeholders are really struck when we talk about nursing being, of course, in hospitals and clinics and settings that people tend to think about, but in such a wide variety of other settings. So I think raising awareness of the many places where nurses contribute to improving the public's health, I think I found over the last 18 months is very beneficial. And then I think in terms of research specifically, I think generating the evidence on how nurses make a difference and do improve health outcomes, I think is really important. And I think that's where NINR can certainly play a role in terms of showing the value of nursing in the community and the wide variety of settings in which we work.
Thanks so much.
Yeah, thank you, Amanda. The next question is how to improve community trust in science and research guided recommendations.
I see the question there. Any thoughts about
how to improve community trust?
Well, I think Yeah, I mean, community partnered research, and I think I saw a comment about research with others as opposed to on others, and I couldn't agree more. And so if I said on, I stand corrected. I completely agree. I think partnered approaches, engaged approaches is what's ultimately needed, part of what's needed to build trust. I think another thing we know, and we certainly have heard a lot about over the last year or two, is the importance of sustainability. So not helicoptering in and out, staying even when the funding ends, developing those relationships, sharing resources. And so as we think about programs we're developing at NIH, those insights and those lessons are certainly being kept in mind.
And the next question is, can you speak to what the NINR is doing or supporting in terms of maternal newborn health, particularly in regard to health disparities and outcomes?
Yeah, thank you, Sharon. Hopefully you saw that we did have an RFA that closed at the beginning of April, focused on improving new models of care for improving maternal health outcomes. So that is an example of something very recent that we've done to support research in that area and on that topic.
The next question is from Amy regarding LGBT. So she's wondering about how LGBTQ plus health and healthcare appear in the NINR funding portfolio and future funding opportunities.
Mm-hmm. Yeah, I don't have data with me today in terms of our current funding portfolio, but one of the guiding principles, as I mentioned, was really focused on diversity, equity, and inclusion. And I think certainly LGBTQ plus populations are very important. We know that there are tremendous disparities, and so certainly it's a commitment that we have to do support work to improve outcomes and reduce disparities in that population.
Great. The next question is from Ariel. Are there any specific funding opportunities for studying microbiomes in general? Or would it be needed to include health disparity?
Oh, okay. Thank you for that question. I can't, comment on specific topics, of whether NINR will support specific topics. What I can tell you is what I shared today. This draft strategic plan framework has the guiding principles that will, guide our decisions as we move forward. And it has the 5 research lenses. So we simply ask that proposals coming to NINR carefully consider whether their applications meet the guiding principles, and then are framed in terms of one or more of the research lenses. So certainly health equity is part of the mission of NINR. It's part of, we really are focused on optimizing health and advancing health equity. But that's what I can tell. I can't comment though on any particular topics.
Thank you, Dr. Zenk. The last question in the chat is from Danielle, and we still have about 5 minutes for questions. If anyone else has questions, please just include it in the chat. So the question from Danielle is regarding the integrated model of care to improve maternal health outcomes among women who experience persistent disparities. So what are some of the goals, approaches for that program to reduce maternal health disparity?
Oh, sorry, I'm looking at the comment just to make sure I can answer it. So that was the RFA that was out and closed at the beginning of April. We're certainly looking forward to reviewing the applications that were received and funding meritorious research. We hope in that area. So if I'm not answering I might not be quite capturing your question. So feel free to reach out to us if I don't do that. Oh, thank you, Joanne. Joanne has put a link to the RFA. So that would give you more information about how that was framed in terms of that area of research. I hope that helps, Danielle. Oh, good. Okay, thanks.
That's great. And I think there was an earlier question regarding whether or not Asian Americans are considered minority. So I think Joanne also sent a link regarding the definition of minority population based on the NIH definition. So that's really helpful. Thank you, Joanne. Any other questions from the audience? Feel free to unmute yourself.
I have a question. So what is some advice that you can give to early career researchers on what best to do?
Thank you. I mean, well, one, we need new nurse scientists. We need people who can help us solve our nation's pressing health challenges. So I'm always glad to talk with early stage investigators. But I think in terms of advice of what I could say, I think it's so important for each of us going into research to be passionate about the topic you're pursuing, to be bold and creative in all aspects of your study. I think if we're really going to make a difference in improving the public's health and the health of everyone, I think it's really important to consider how your research will ultimately inform practice and policy. Research we do is vital, but people will not benefit from it unless we ask questions that have relevance for practice and policy. So I encourage you to think about that right from the start. And then as we've talked a little bit about, I think working with other disciplines, finding the right partners, both scientifically and in the community is so important. We need to build on one another's strengths. No discipline and scientists certainly do not have all the answers. We need to partner up if we're really going to solve the very challenging issues that our nation faces.
Thank you.
Any other questions? Okay, if not, I think this concludes our morning presentation from Dr. Zhang. And thank you so much, Dr. Zhang, for the very informative presentation and Q&A. We appreciate you.
Thank you. Thank you so much for having me. I enjoyed it. Thank you.
Thank you.
Thank you.